Hello, my name is Gretchen Shelesky. I'm from UPMC St. Margaret Faculty Development Fellowship, and I'm here to talk to you about my ADFM Leads Fellowship project called Family Medicine Faculty Development, the long-lasting impact of a single in-person, highly interactive half-day workshop. After your active participation, you will be able to review the timeline of my project, to discuss the preliminary results, and to discuss the next steps of the project. We really started to develop this project in February of 2023. I got IRB approval the day before my first session in September of 23. I will give my last session in March of 2024, with my last follow-up survey being in June. We start each session with a review of the study design, which is a pre and post survey done the day of the session on paper, followed by the 3-month post survey delivered electronically. Each of the sessions then goes on to do a short marketing session for the fellowship. This is to help with recruitment of traditional and faculty track fellows, and this includes our mission, our core values, and our teaching domains. I also review our fellows' clinical and teaching duties, opportunities for degree programs like the Masters of Medical Education and the Masters of Public Health, where our physician and our pharmacy graduates are practicing now, and what impact the fellowship will have at the SDFM annual conference. I delivered these at the UPMC Family Medicine residency programs, at the department, which is at the School of Medicine, Shadyside, McKeesport, Williamsport, Horizon, Altoona, Harrisburg, and Lidditz. You might be saying, like, what did I deliver? Well, it's a little bit of a black, or in this case, a brown box. The programs got to choose their own content from a list of options. I delivered 2 to 3 sessions over a 3 to 4 hour in-person session. These sessions were really mostly about the doing and not so much about the theory behind them. Each site had their own colored paper so that I could keep the data collection organized. All surveys asked the participants to rate their level of competence on a list of topics. The pre-survey also had demographics, and the post-survey had some impact questions. My wild card part is whether that or not these half-day workshops will impact the ACGME question on faculty development. And so we'll be able to collect that data in a few weeks. Our participants were from 7 programs. We had 59 participants, and they really varied in experience in academic medicine from 0 to 40 years, with the mean being 11.5 years. Most people got better after the workshop. That's good news. And we had 128 pre-post measurements, 76 improved, 52 stayed the same, and 5 got worse. They also really wanted to be able to do another workshop like this. So 48 were extremely likely to attend again, 9 were likely to attend again, and had 1 person who was extremely unlikely to attend again. And the sample size, it was 58, as 1 person left it blank. The participants valued being in person. This allowed for discussion and questions and troubleshooting. They saw the modeling of the techniques that were being taught. We practiced skills and allowed for hands-on support, and it was more engaging and interactive. They liked that it was small group or teamwork for most of the time. They were interacting with other professionals, and so they were learning from others in the room. They were able to read other people's body language, and it allowed for an informality in the session that wouldn't otherwise be there. Our post surveys looked at the most impactful thing learned, the value of the session, and how the learners will be impacted by the session. But of course, these were specific to the session. So they were a little bit different between each of them. And 1 person got a teaching award after going to our session. So they asked them how to improve the session. They talked about pre-work preparation, working from the strengths of the program. Some asked for longer, some asked for shorter, and people asked us to come more often. So what's next? We have 2 more to give, 1 in Harrisburg and 1 in Lidditz on competency-based education. We'll be analyzing the post-post data, and we'll get the ACGME data from the surveys. In the broader sense, I think the things that we're thinking about next is presenting potentially nationally, maybe a train-the-trainer model so that we can really get other people up and running, and perhaps some qualitative interviews to supplement the data that we collected here. I just wanted to thank the ADFM Leads Fellowship for the opportunity to work on this project and to present to all of you. I hope you enjoyed the Ignite talk on family medicine faculty development.